Now we move on to sinus bradycardia, where the heart rate is slow, less than 60 per minute. The rhythm is regular. The P wave is present with normal QRST and interval, but QT interval may be prolonged. Why? Because the cardiac cycle takes longer time in bradycardia. Normally it is seen in at rest, sleep, and in athletes. It may be prolonged when somebody is taking beta blocker for a long period of time. Pathologically, bradycardia is seen in hypothyroidism, raised intracranial pressure, and many other conditions. How to count? Count the large number of squares, large size small squares between the two R wave. If the large squares in the two R wave are 5, then 300 divided by 60 will give you the heart rate. 300 divided by 5 will give you 60, and 60 per minute is the heart rate. Similarly, sinus tachycardia is a fast heart rate over 100 per minute. With normal P, normal QRST wave, and heart rate is regular. Now it is physiologically the sinus tachycardia can be seen in exercise, excitement, high altitude, and pathologically the examples are fever, anxiety, cardiac failure, and many other cases. Now we move on to sinus tachycardia. It is continued. Now sinus tachycardia, how will you know? By looking at ECG, count number of large square between the two R wave. Large square means they have 5 millimeter each in line, and will have 25 small squares. So 2 large squares, if it is there, then 300 divided by 2, that is 150 will be the heart rate. 150 will be the heart rate. Then lastly, sinus arrhythmia. Here the heart rate is faster during inspiration and slower during expiration. Increased in inspiration, decreased in expiration. It is only normal arrhythmia seen in adults and young children and in athletes. It shows the normal activity of autonomic nervous system. As we grow older, this sinus arrhythmia you may not find. And all types of autonomic neuropathy, you will not find sinus arrhythmia. This is a good test to test an autonomic nervous activity in the system. It is caused by variation in the vagal tone during the respiratory cycle.